longer available. I was wondering if you would do live, if you can cover Allergan, as I've seen reports on these being withdrawn due to cancer risks. I have these in and have had capsular contracture, so I'm a little worried now. Yeah, you might have seen this topical in the news about Allergan implants have been, well, what happens is they, implants have to, or implant companies have to get a CE mark, which is a mark to say that they're okay to sell in the Europe, and they have to be, the CE mark has to be renewed, and they haven't renewed their CE mark. So it's not that they've been they've been actively, well, anyway, that's what's happened. They haven't renewed their CE mark. So therefore, they cannot be sold in the UK or in Europe. And this is related to ALCL, which is a type of cancer associated with breast implants. We always used to say that breast implants can't cause cancer. There is now one called ALCL. It's very, very rare, but it's out there and it's associated with breast implants. So you need to know about it if you're going to have implants. And they found that there were quite a lot of cases. They thought it was due to the texturing of the implant. Am I them? I don't know, maybe I'm them. We thought it was due to the texturing of the implant. The reason we think, we didn't thought, we think. And the reason we think that is because there are no cases of ALCL in patients with smooth implants. So smooth implants haven't got any texturing. And so we think it might be something to do with the texturing. And I think there was quite a lot with Allergan, with the texturing, and they thought maybe it's something to do with their texturing. We don't know what causes it, to be honest with you. And the only reason we think that it's due to the texturing is because there's no cases with smooth. There's no sort of causal relationship. So tomorrow there might be a case for smooth, and then we'll think, well, that's gone out the window. So therefore, there's some surgeons are now just putting in smooth implants. We're all telling people about this, but there are no cases with smooth. So if you want a smooth implant, or if you want to have no risk of ALCL, well, I can't say there's no risk because it might, as I say, tomorrow someone might turn up with a ALCL with a smooth implant. But there are no cases with smooth implants. So, but there were quite a lot of cases with Allergan, and they thought it might be associated with this texturing. It is a very rare condition. 1 in 25,000, 1 in 30,000. This is the sort of figures that they're quoted, and it is treatable. It's got something like a 95% cure rate by removing the capsule. It's a cancer of the capsule. It's not breast cancer. It's a cancer of the capsule. It's a lymphoma, and it is treatable. So it is rare, but they haven't renewed their CE mark, so they can't. We can't. I never really used many Allergan implants, but we can't use Allergan. But obviously now people with the Allergan implants think, oh my God, they're terrible. We must get them removed. There's no advice to say you have to remove Allergan implants. So if you've got Allergan implants in, I would say don't worry. You probably are worried, think, God, what's going on? But you know, the advice is don't worry. If you have a swelling, if you have a lump, and you've got breast implants in, you should see your doctor, whether you've got any Allergan or any. Well, to be honest, even if you haven't got implants in. But anyway, certainly if you've got implants in, that's how ALCL presents. It presents with a swelling or a lump, and it's usually sometime after having implants put in, about 8 years post implants. But as I say, it's a very rare condition, but that is why they have been withdrawn, and that is why people are now moving towards maybe smooth implants. The problem with smooth implants is they've got a higher rate of capsular contracture, and they've got other issues. You can't have teardrop implants because they don't adhere, so they don't so you can't have teardrop, and so you know, it's another risk, and is the risk of capsular contracture. Therefore, if you have a capsular contracture, you might need more surgery, and there's risks with having more surgery. Is that outweighed by the risk of not getting ALCL, which is such a rare thing? All we can do is tell you what's out there, and you know, we'll give you information on it. But as I say, if you've got Allergan implants in, the advice is you don't have to worry, you don't have to have them removed, you don't have to worry about it. But if you are worried, go and see a surgeon, get checked out. And certainly if you have a lump or a swelling and you've got breast implants in, regardless of what make of implants you've got in, go and see your surgeon to get checked out. But at the same time, please don't panic. To put it in some perspective, the risk of breast cancer is 1 in 8, and it's got a anywhere near like the curable rate of ALCL. So, 1 in 8 versus 1 in 25 to 30,000. But you've got a choice whether you have implants. This is something we tell everyone before they have implants, because you've got a choice whether you have implants or not. If you've already got implants in, I wouldn't be panicked about it, because I think it is a very rare thing, and it's not really something that even the biggest unit in the world, wouldn't see many cases, because 1 in 25, 1 in 30,000. There's about 10 to 15 cases per year worldwide, with about 10 to 15 million people with implants in. So it is a rare thing. But yeah, that's what's happened with Allergan, and it's a bit watch this space really, because that's actually just happened recently. So it hasn't really affected us because we never really used Allergan, but I think it has rocked the industry a bit. Like, ooh, everyone's going towards either smooth implants, or they're going towards what's called nano texturing. So textured implants are quite rough. I looked around as if I had any. I haven't got any here. Textured implants can be, you can have levels of roughness. So some are very textured, very rough. Some are totally smooth, and then there's some ones in between. So some people are moving more towards nano texturing. There might be something there, as a sort of halfway house. And some are so nano textured, some are so not that textured that they're actually classified as smooth, although they are a little bit rough. And whether that's a good thing, I don't know. You could argue there's a problem with the texturing. Nano texturing is better than macro texturing, but surely smooth is better than nano. I don't know whether we should be using nano, whether we should be using textured. Personally, I use textured implants, and I use polyurethane foam implants, but I tell everyone about the risks, and I say, look, there's no cases of smooth implants. If you want smooth implants, you can have smooth implants, fine. Put some smooth implants in a few weeks ago. That's absolutely fine, but there is a risk of increased risk of capsular contracture. So it's a tricky one. A bit like choosing your surgeon. Nightmare, isn't it? Once you've chosen your surgeon, then they give you all this stuff.